Welcome to another edition of This is Public Health, a podcast from the Illinois Department of Public Health. Our focus today is on mental health during this Mental Health Awareness Month. We have several special guests today, and we'll be introducing them as we go along. We start with Dr. Dana Weiner. She's the director of the Children's Behavioral Health Transformation Initiative. Dr. Weiner, thanks so much for your time. Great to have you here.
It's a pleasure to be here.
Before we get into some of these issues related to mental health overall, tell us a bit about your background and how you came to take on the role as head of the Children's Behavioral Health Transformation Initiative.
So I'm a clinical psychologist by training. Have spent the last 25 years or so providing data analytic consultation and help to state agencies that serve children and families in implementing new initiatives. I did that as a faculty member at Northwestern and then later joined Chapin Hall. And in the middle there, I spent about 6 years on the DCFS director's leadership team within the state's child welfare system. I've also had the opportunity to work with child serving systems across the country. And in that capacity, have observed many of the challenges and opportunities that are in our public child serving systems. So I came to this work because I had, in 2019, had done some work for the governor's office to try to help shine light on some child fatalities among families that had been involved with the child welfare system in Illinois. In February of 2022, in recognition of burgeoning youth mental health crisis, the governor's office reached out for an detailed analysis of our children's behavioral health service system. Following that analysis, our governor showed his commitment to this issue by issuing an executive order that we would implement sweeping changes to transform our children's behavioral health service system, and I have the privilege of leading that.
We're going to talk more about that initiative coming up. I want to start by talking in some broader terms about overall mental health and access to services here in Illinois. In Illinois, mental health issues fall under the jurisdiction of several state agencies, including IDPH. Talk, if you would, about how that has impacted health services, mental health services in the past, and what's happening now to address that issue.
I think the perception is often that we don't have enough of the mental health services that we need for kids. But I would say that a large part of that capacity shortfall is actually lack of information about the things that are available and a difficulty in navigating very complex systems. So as you mentioned, because the behavioral health supports are situated in 6 child serving agencies, and those include the Department of Human Services, the Illinois State Board of Education, the Department of Children and Family Services, the Department of Juvenile Justice, Department of Healthcare and Family Services, and IDPH, it's very, very hard for a parent to know where to start. And what they are able to access sometimes depends on which door they come in, and that shouldn't be the case. And that's something we're working to change, to really absorb all of that complexity behind the scenes so that parents have a single place to go. And the state figures out what the appropriate matches and programs and eligibilities are. That would really be a transformational improvement.
And that certainly offers a great deal of hope and promise for the future. For right now, though, as people are dealing with these issues daily and trying to navigate this system, what do people need to know about getting help with a mental health crisis, whether themselves or for a family member? Where can they turn for help?
First, let me just highlight that if anyone is in crisis and feeling at risk of hurting themselves, feeling suicidal, they should call 988 statewide suicide crisis line. I think for problems that are less severe, depending on the age of your child, it's often best to start either with the pediatrician or with the school, because both of those are places where all young people are seen, and both have the capacity to connect families with services. So in the pediatrician's case, they could connect families with early intervention services that are geared toward helping kids catch up when they're delayed in meeting developmental milestones, things like speech and language or movement or other things. In the school context, any parent can request an evaluation for an individualized education plan because oftentimes those problems create challenges that make it harder for kids to learn in school, and it is the school district's responsibility to address those challenges. Outside of that, there are certainly many other resources available to families, and what we're trying to do is put them all in one place. So there is help on the way for families that we can talk more about.
We know that one of the unique challenges that pertains to mental health is the perception that there's a stigma attached to this. This is something to perhaps be ashamed of or that leads people to be reluctant to seek out that kind of help. Why, in your view, does society treat mental illness differently, and how do we change that perception?
So there certainly has been a long history of pathologizing and shaming and blaming people who are struggling with mental health problems. And we have not necessarily come as far as we maybe hope that we have in changing that. But I will say that it's my observation that younger generations, people who are kids and teenagers today, seem far more comfortable acknowledging mental health problems and asking for help for them than their parents' generation are. They are familiar with what trauma means. They use the word trigger. They talk about anxiety. They talk about depression. And while it's not easy for them necessarily to talk about those things or to ask for help, there certainly is more acceptance among young people today than there is, I think, among people who are parenting them. And that can create some additional challenges if kids are knowing that they need help and parents are not necessarily comfortable with seeking services. I think we have a way to go in creating parity, making mental health accessible and acceptable as medical care. We would never dream of letting people languish with medical problems to the extent that we let mental health problems languish.
You're listening to This is Public Health with the Illinois Department of Public Health. We are focusing on mental health as part of Mental Health Awareness Month and talking with Dr. Dana Weiner, director of the Children's Behavioral Health Transformation Initiative. One project in the works right now is a mental health bill of rights. Talk a bit, if you would, about what that is and what you hope it can accomplish.
So this is really a very exciting new development that has arisen out of our broad engagement with people in all parts of our state, including parents and young people with lived experience. We really have heard all of these people when they've expressed the things that they want and need and hope to have. And we also have collaborated closely with people, with helpers across our state who work for the agencies that we've been talking about. And together we have co-developed a document that lists a set of things that we think should be rights that people have, including the right to be free from stigma in seeking help, the right to receive appropriate mental health services in the language that you speak and in the community of your choice. And those are things that right now are aspirations, but we think that having a list of shared intentions around improving mental health service delivery can help us all move toward making that a reality. So they're not all things that we can guarantee people today, but they are things that we want to be able to say in the future that people are guaranteed. And I can just say that people's reactions to this document have been really positive, and we hope to be able to share it more broadly soon.
Well, we're looking forward to hearing more about that in the near future. Dr. Weiner, let's turn our attention back to the Children's Behavioral Health Transformation Initiative and talk, if you would, about why it is important to have this focus on mental health services for young people.
So there are a few reasons why I think our governor really was prioritizing children's behavioral health. One was that children's mental health problems were on the rise prior to the pandemic, but certainly the pandemic exacerbated feelings of uncertainty and stress and isolation among young people. And so we came out of that with higher rates of children needing help and a workforce shortage. So we had less capacity, less supply essentially, and more demand. That's one reason. I think another reason is that unlike with adults who can seek services for themselves, kids operate within these other contexts, either in the family or in the school or community, and they're dependent on adults recognizing that there's a problem and knowing what to do about it. So that adds another level of complexity. And then add to that, as we've mentioned, there are 6 systems that all have programs that intend to reach children. And you've really got something that requires its own focus because it can't just be lumped under adult mental health. You really have to look at it with a different
I want to bring into the conversation now Regina Crider, who is a senior policy analyst and has worked very closely on these issues, but has also had firsthand experience as a parent in dealing with some of these challenges as well. Regina, if you would talk about your experiences here and how that's informed your policy views on this.
Thank you, Jim, for such an important question. So focusing on services for young people and their families is critical for several reasons. Some of the things that Dr. Weiner has already stated, but one in particular is early intervention. And that's because 50% of mental health issues start by the age of 14 and 75% begin by the age of 24. but treatment for those issues doesn't typically start until much later in life. And I can understand how vital this is because I've been there with my own daughter. When she started school, I noticed some behaviors that were pretty worrisome to me and my husband. And so naturally, we brought them up to our family physician. And at that time, she was about 6 years old. She didn't have her first mental health crisis, though, until she was 10. But it took us until she was 14 to actually get the proper diagnosis. And if you add all of that up, it literally took us 8 years to get the answers that we needed for her in order to move us in the right direction for what she needed. Another reason why I think this is important to focus on is because of the social emotional development in children and in our young people, because a child's mental health affects every aspect of their life, from their friendships, their relationships with their families, within the community, what's happening with them at school. And if that's not working for them, then they are going to struggle. And like Dr. Weiner said, they need to be able to reach out and get those services. So that's why it's important for them to have easy access to help. We want kids and families to get the support that they need without having to jump through hoops. And then one last thought is treatment. Untreated mental health issues can lead to a whole mess of problems that most people are not even aware of, from struggling to even find work as an adult, which was one of the areas that my daughter struggled with when she became of age and wanted to enter the workforce, and ended up in just making in bad situations across the board. So the reality is if we don't deal with our children's mental health on the front end, we end up paying for it on the back end.
Sticking with that theme of trying to simplify this process and make it easier for families to access the services that they need, I want to bring in now Mike Stiehl, Chief Technology Officer for the Children's Behavioral Health Transformation Initiative, to talk about what's called the Beacon Portal. Mike, explain, if you would, what is the Beacon Portal and how will it work? What will it mean for families dealing with these issues?
So Beacon will be the front door for families to access behavioral health services for their children in Illinois. It's basically a routing application meant to simplify the process, navigating what is often a complex and fragmented behavioral healthcare system in the state. And it'll work by guiding families through a set of streamlined processes that will help them articulate their needs, and then identify suitable services that address those needs, and then connect them directly with the care providers who can help them.
I know this can't be a simple endeavor to create this kind of a platform and a portal to bring all these services together. Talk a bit, if you would, about the process of developing this.
Well, it's really been an extraordinary process, Jim. I mean, frankly, we've had to coordinate, as Dana mentioned, across 6 different child-serving agencies in this state. In creating Beacon, we've really worked closely with the Department of Human Services and their team to make sure that all of those stakeholders have a say in how the system works, and to make sure that it is also serving the families who'll be using it. So the development process has been done with Google, and they've been a really great partner to help us really work in the experiences of the users as we build it.
Dr. Weiner, as we wind down here, I think one thing that's very clear is that there is definitely help out there. It is available. It has been at times challenging to access that help. That is improving and progress is being made. But as we wrap up the discussion here, what's the best advice you can give individuals and families who are dealing with these mental health issues?
First, I just want to reiterate that more help is on the way, but that there are lots of programs and services out there. And I would encourage families, as I said, to work within their school, to seek assistance, to work with their pediatrician, but also, until we have this centralized portal, to reach out to some of the state agencies that also now can provide help. So that would be the Division of Mental Health at the Department of Human Services.
We'd like to thank all of our guests for helping to shed light on this important issue during this Mental Health Awareness Month. Dr. Dana Weiner, Director of the Children's Behavioral Health Transformation Initiative; Regina Crider, Senior Policy Analyst and a parent who has dealt with this firsthand; Mike Stiehl, the Chief Technology Officer with the Children's Behavioral Health Transformation Initiative. Thank you all so much for your time and for the important information you shared with us here on This is Public Health from the Illinois Department of Public Health. Join us next time.